The crucial role of oxygen in blood. Unveiling its hidden importance for health. Oxygen is essential for life, acting as the fuel that powers our biological processes. It is the glue that holds together our energy production, cellular functions, and overall health. Without adequate oxygen levels, our bodies can struggle to perform basic functions. In this post, we will explore the key role of oxygen in blood, its critical functions, and its profound impact on our health. Understanding oxygen transport in the blood. Oxygen is transported in the blood primarily by hemoglobin, a protein in red blood cells. Each hemoglobin molecule can bind to 4 oxygen molecules, allowing blood to carry significant oxygen levels. For example, a normal adult typically has about 15 grams of hemoglobin per 100 milliliters of blood, which can transport around 20 milliliters of oxygen. Oxygen transport can vary based on several factors, such as altitude, physical fitness, and health status. For instance, people living at elevations above 8,000 feet often have increased red blood cells, enabling them to cope with lower oxygen levels. Studies show that these individuals can have up to 30% more red blood cells compared to those living at sea level. Close-up view of red blood cells. Under a microscope, red blood cells are essential for oxygen transport. The role of oxygen in cellular respiration. Cellular respiration is how our cells turn glucose and oxygen into energy, carbon dioxide, and water. This energy, stored as adenosine triphosphate, powers various bodily functions, from muscle movement to nerve signaling. Oxygen is particularly critical in the final stage of cellular respiration. Here, it acts as the final electron acceptor in the electron transport chain. When oxygen is insufficient, cells struggle to produce ATP, which can lead to symptoms of fatigue and weakness. In fact, research indicates that even a slight drop in oxygen saturation below 90% can result in decreased energy levels and cognitive function. Maintaining adequate oxygen levels is crucial to prevent such decline. The impact of oxygen levels on health. Optimal oxygen levels in the blood are vital for overall health. Low oxygen or hypoxemia can lead to various health issues, fatigue and weakness. Low oxygen can reduce energy levels, hindering daily activities. A study found that 70% of patients with chronic fatigue syndrome reported low oxygen levels. Cognitive impairment. The brain relies heavily on oxygen. A study revealed that individuals with hypoxemia often experience confusion and memory problems, particularly in older adults. Respiratory issues. Diseases like chronic obstructive pulmonary disease can limit oxygen transport. Nearly 15 million people in the U.S. suffer from COPD, making effective oxygen treatment crucial for this population. Cardiovascular strain. Insufficient oxygen makes the heart work harder, increasing the risk of heart disease. Research shows that individuals with chronic low oxygen levels are 2.5 times more likely to develop cardiovascular problems. Eye-level view of a healthy lung model. A healthy lung model demonstrating oxygen exchange factors affecting oxygen levels in the blood. Several factors can influence blood oxygen levels. 1. Altitude. At high altitudes, the lower oxygen availability can lead to altitude sickness, with symptoms such as headaches and nausea experienced by roughly 25% of individuals who ascend rapidly to heights above 8,000 feet. Acclimatization can help, but it often takes several days to weeks to adjust. 2. Physical activity. Regular physical activity increases the body's demand for oxygen. During exercise, heart and breathing rates climb, enhancing oxygen supply. Athletes typically show 10% to 15% higher hemoglobin concentrations, which allows for better performance and endurance during strenuous activities. 3. Health conditions. Certain health issues can hinder oxygen transport. For example, anemia reduces the number of red blood cells tasked with carrying oxygen, affecting up to 3.5 million people in the U.S. Additionally, lung diseases can severely impact oxygen absorption. Addressing these health concerns is crucial to maintaining healthy blood oxygen levels. The importance of oxygen in healing and recovery. Oxygen is pivotal in healing. Adequate levels are necessary for tissue repair and regeneration. In cases of injury, the body requires increased oxygen to support healing. Hyperbaric oxygen therapy is an effective treatment involving breathing pure oxygen at higher pressures. This therapy has shown promising results in speeding recovery from injuries, with studies reporting recovery times can shorten by up to 50% in certain cases. How to improve oxygen levels in the blood. Maintaining balanced oxygen levels is essential for well-being. Here are some practical ways to boost oxygen levels. 1. Engage in regular exercise. Regular physical activity boosts cardiovascular health and oxygen transport efficiency. Aim for at least 150 minutes of moderate intensity exercise each week. This includes activities like walking, swimming, or cycling. 2. Practice deep breathing. Deep breathing exercises can enhance lung capacity and increase oxygen intake. Techniques like diaphragmatic breathing can maximize oxygen absorption, especially beneficial during stress or anxiety. The connection between oxygen and mental health. Oxygen levels also significantly affect mental health. Research indicates a link between low oxygen levels and increased anxiety and depression. For instance, studies show that patients with chronic lung diseases often report higher rates of anxiety due to low blood oxygen. In addition, practices such as mindfulness and yoga can improve breathing and boost oxygen intake. Integrating these practices into your routine can enhance overall mental well-being. Closing thoughts. Oxygen is a vital part of blood, influencing energy production, cellular function, and overall health. By understanding the importance of oxygen in our bloodstream, we can take actionable steps to maintain optimal oxygen levels for better well-being. From consistent exercise to mindful breathing and a nourished diet, prioritizing oxygen levels could dramatically enhance physical health and mental clarity. Recognizing oxygen's significance is key to achieving a balanced, healthy life.